Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. Hey, guys. Welcome back. I'm here today with Lacie. How's it going, Lacie?
I'm going good. So far, so good.
You're staying healthy? I feel like everyone I know or everyone's kids, one or the other, is sick right now.
Yeah. Child.
Yeah. I think it's, we were masked up for so long. Nobody was getting sick. And now this year, there's just so much going around.
Oh, yeah.
But as long as we're staying healthy, I think.
We are. Yeah. I think Remy's issue is preschool.
Yeah.
It's been a long journey of sick and not sick and sick again.
I know. I think being in healthcare, you're exposed to so many bugs that you build up such a strong immune system.
Yeah.
So do you have a beauty or a blemish?
Oh, I have both. I'm going to start with my beauty. Although it's my beauty, it's probably not so much for my staff, but so there's this thing, and I don't know if you've noticed it yet. When we have newbies come on or like our interns come in.
Yes, we did get some new interns this week.
I love it. And it's always great. But there is something with our office, something in the air that whenever we have someone new come in and shadow, we get nothing but private part concerns. So this poor intern, she comes in and she's, at the end of the day, I was like, how was it? What do you think? She's like, whoa, I didn't realize that you guys, saw every aspect of your body.
Yes. Oh my goodness.
A lot of people don't realize that.
Yeah. So she was with Natalie.
Yes.
And every skin check was what?
It was a concern in the groin, anal concern.
And these are really young kids. So I think they were, this is their first rotation, like in a medical office and like a medical setting. So they were probably like, whoa,
I did not realize that. Yeah. And I always get a kick out of it. And I hope it doesn't offend anyone, but I enjoy seeing newbies' faces when they come from a full day of seeing just privates. It cracks me up because it just makes me think of my first time working in general surgery. Yeah. It was a lot of things you didn't expect that you would see.
Well, it's kind of like, working in urology or working in OBGYN. That's all you do. But I guess when you think of dermatology, you don't necessarily think of that. But you have skin everywhere. And people get really, a little nervous or anxious. But I think as doctors, it's just like another body part. Yeah. So if you get embarrassed about or want to ask your doctor about buttony or something on the penis or vagina or whatnot, don't be shy. But yeah, the interns were so cute. I was like, hi, I'm Dr. Shirazi. And one of them just looked at me and she was like, hi. You could just tell it was like their first time. But I love getting young people in the office. I feel like, they learn a lot. I learn a lot from them.
Yeah.
So
it's fun.
So what is your blemish today?
Oh my gosh. You will never, well, you see it all the time, so I'm sure you'll believe it. But my girlfriend, single, ready to mingle.
Your friends are just scandalous.
Vicariously through her. So she tells me all about this hot date she had and her fun makeout session afterwards. And apparently this guy has like a beard, and she's always been into beards, but like apparently
beard or goatee?
No, I mean a beard.
Okay.
Yeah. That's what it sounded like, but very big beard.
Big beard.
Okay. Yeah. And so she's just like going on about how afterwards, like the next day or so, she felt like this irritation under her chin. And she was thinking it was from his hair. And then shortly after, she just broke out with just these pustules, like blister-like pustules all over her chin area. Oh. And I instantly thought herpes.
Oh.
She went and got checked out. Apparently, they gave her an antibiotic and sent her on her way. But
herpes is caused by a virus. So if they gave her antibiotics, it probably was that. But, there is a skin condition that you can get from that. And it is from the beard, making out with men or boys that have beards, because beard hair has like dirt dead cells, bacteria. I mean, not to gross you guys out.
Yeah, that's not
But
disgusting.
even like a goatee and men's facial hair is coarse. And a lot of that, vigorous, kissing and rubbing and friction can certainly make little micro cuts in your skin, cause irritation.
Yeah.
And then if there is some bacteria, whether it's on, her skin or his, hair, beard, then that gives the bacteria an opportunity to slide right into the skin and cause a bacterial infection. And that's probably why they gave her antibiotics. So it could be like strep or
okay,
staph.
that makes more sense.
Yeah, because, beards, sometimes men may not really deep clean their beards, especially, I don't know how young.
I just always picture like just food buried in a beard.
Food,
no offense, but
dead skin, little staff just hanging out in the jungle of the beard.
I'm thankful my husband does not have a beard.
I really love a goatee. I love my husband with a goatee.
Yes.
I think it's super sexy.
Yeah, my husband has one too.
I guess he doesn't have a beard, but I guess the more hair there might be, then that gives the bacteria surface area to live on. So I love using like a glycolic and salicylic acid cleanser. I know that the men really love the exfoliating cleanser because it comes out foaming.
Yep.
So you don't actually have to wet the beard or the face. You can just put it directly on the skin and it's already lathered. So when you pump it out, it comes out as a lather. So it makes it really easy to use on the beard. And it's not like benzoyl peroxide that could bleach things. So that's the other reason I love it. So it's antibacterial and anti-yeast.
Yeah, my
and it
husband loves
exfoliates, the dead skin and everything off the beard. So that would be, maybe you should mention that to her as a Valentine's
She's given
Day
up
gift.
on beards. Yeah, she's traumatized. She's like, I will
She's like,
never.
no more making out
Never.
with men with beards. Oh. Well, it
my
must have been a
gosh.
really good session.
I mean, right?
I mean, if she managed to get an infection, wow.
I can't. How about you? What's your beauty and blemish?
Let's change the subject. We're
let's
both married
move
for
on.
way too long.
Yeah.
I guess my beauty is that I finally got to go and get my nails done yesterday. And, I
Jealous.
if there's one thing that I just have this pet peeve about is just bad nails. I think it just looks so awful. Like
As I hide my nails right now.
well, if you don't have polish on, that's fine. I'd much rather do that. But I had gel and you know how like it starts to come off and I try to extend my gel as many weeks as possible. I'm talking like 4 or 6 weeks. That's why I never get like colored polish. I try to get something like neutral so it blends in, even though it's been like, I want to say it's been like 6 weeks or something. So
Oh my gosh. That's a long time.
I know. It was way before Christmas when I went. So
Wow.
anyway, I was like the last person. I was begging these people, please. It's been a long day. I have like zero time in my life. Can you just do this? And the lady was just I kept messing up. She's like, fold your fingers, fold your fingers. She was kind of like a nail Nazi. And the more she told me to like bend my fingers, the more I would like.
More stressed out you were.
Then I would mess them up and she'd be like, oh, you messed them up again.
Oh my gosh.
She was a Nazi. I could not wait until we were done. So anyway, I guess that was my beauty. But my blemish is I was getting just tons of calls and messages on this new study at UCSD on gel nail manicures. Did you see that?
Yes, I did.
It was all over the news. People just love the shock factor of things, where it was a good study. It was published in Nature, which is a prestigious journal. And these scientists looked at skin cells, not humans, but cells, and they exposed them to UV from the gel manicure lamps that you see, because for gel manicures to harden, you need UV. That's the only way. And they exposed these cells to 20 consecutive minutes for 3 days and noticed that they were susceptible to cell damage and also mutations that were cancerous, essentially. So cancer-causing mutations. Of course, everybody is like, oh my gosh, should I stop? Should I stop getting gel? Da, da, da. I always say, it's not the poison.
It's the moderation.
It's the dose. What I worry about is these young teenagers. I see them at the nail lounge and they're like 14 and they're coming in like every 2 weeks and getting gel manicures. Well, that UV lamp, even if it's LED, it's still UV light. It's like tanning bed for your hands. And long term, if you're doing this for years and years and years, you know, it's cumulative and cancer is cumulative. So I don't want to brush the study off and say, okay, nobody sits under the UV lamp for their nails for 20 minutes, 3 days in a row. But
it's over time.
Yes, it's over time. So I think there is some merit to the study, even though it wasn't on humans. We can certainly take it and maybe modify the amount of times that we're getting gel manicures. It's like once you go to gel, you can never go back.
It's so true. Oh,
it's so easy.
But you know, some salons will put SPF on your hands.
True.
I mean, that's a start, right?
Yeah. So that's good. And I love the UV gloves that you can wear. So that's good. And, you know, I think as long as you can not go all the time and don't start super young, like my daughter's like begging me to want to go and get gel manicures. I'm like, oh my gosh, you're only like 14.
And her nails are beautiful.
And your nails are
naturally beautiful.
Yeah, and you don't want to ruin your nails when you're younger from all the trauma of removing the gel. So
what's the difference between UV and LED?
That's a great question because the salons will say, this is not UV, this is LED.
Right. But isn't it all kind of...
No, it's still LED lamps. So if it's LED, it's more efficient. So it's more intense UV in a shorter span of time. So you don't have to be under the light as much. But it's still, 4 or 5 times the amount of UV that you would get from the sun.
Got it.
And it's UVA rays, which tend to penetrate deeper into the skin. So if you are going, try to, minimize the amount of skin that's getting exposed and, wear the gloves, the sunscreen, all those things, all those precautions are so important.
Oh, so important. There's so much for us to worry about. But I'm glad that you brought up.
Nothing is good for you, right? But it's like I always say, cumulative risk is what leads to cancer. And certainly there's a lot of other factors.
Yeah.
So be careful with the headlines. Don't get too bent out of shape.
It's all clickbait anyways.
Yeah.
But I'm glad you brought up nails because I really wanted to talk about, have you heard of the red nail theory?
Ooh, no. But if I don't get nude, I always get red. So.
So maybe you might have a good answer to this.
Yeah.
But before we get started, don't forget to rate, review, and subscribe to our podcast. We love hearing from you guys. So don't forget to follow us on Instagram at More Than a Pretty Face Podcast.
Yes, and we do a lot of giveaways, guys. So follow us at More Than a Pretty Face Podcast on Instagram. Hi guys, it's Dr. Azi here. Love is in the air. Whether you're coupled or not, this Valentine's is the perfect time to give your skin the extra love and care it deserves. So I've got you covered with the Self-Love Bundle that comes with a limited edition leather bag, a pure silk sleep mask, along with a detox face mask and brush. Relieve stress, clear your complexion with detox, formulated with medicated sulfur to treat breakouts, kaolin clay, and charcoal to remove oil and impurities. I personally love doing this mask once a week. I paint it on with a brush, which is very satisfying. I meditate for 10 minutes while it dries and wash it off in the shower. So go check out the Self-Love Bundle at AziMD Skincare.com. That's AziMD Skincare.com. Self-care is the best form of self-love.
All right. So the red nail theory you've not heard of.
No,
it's
but
like
I'm
trending
curious.
on TikTok.
Oh my gosh.
So apparently when you paint your nails red, men are more attracted to you, but also you have like more self-confidence.
Oh, well, that makes sense.
That could be more attracting, right?
There's definitely science to that, especially with red lipstick too, right? So you paint your nails red with a red lipstick. I know there's been a lot of studies that show more than 70% of men are really attracted to a woman wearing red or a woman wearing red lipstick. It's always like, it kind of catches their eye. There's something about that woman that makes her come across as more adventurous, more sexy, more, I don't know.
Do you think it reminds them of the little red sports cars?
Well, I think red is just such a sexy color.
I do love red.
It has some, probably some erotic like overtones to it. So there's definitely some science behind that. I know that personally, I hardly wear red lipstick. I always wear nude. But when I do wear red lipstick, my husband's always like, why are you wearing?
Yeah.
I mean, unless it's like,
mine too.
Like if I if I take a picture, like if I do a photo shoot and I'm wearing red, it's like holidays or whatnot, and red lipstick, he's like, why red? Why do you have to wear red lipstick?
It's like too sexy.
Yeah, it's too sexy. He has no problems. He really likes it when we go on date night and I'm wearing red lipstick. But nevertheless, it's something that really is very attractive. So I love that.
It's interesting. So when you paint your nails red, do you just feel more confident?
I hardly ever paint my nails red.
I thought when you don't paint them white, you paint them red.
Yeah, that's true. But that's, because I see patients and I don't want that to be a distracting
so
factor,
it is distracting. Okay.
I want to be professional, I guess. I don't want to like attract too much, because I do talk a lot with my hands too. So, but I do love the color red. Do you have a favorite red nail that you like, or red lipstick? Guys, comment below. Let us know, what is your favorite red lipstick, because I'm always looking for colors.
I have one red lipstick that I rarely ever wear, and I want to say it's Kat Von something. I don't know, but it's like a liquid matte red lipstick and a matching lip liner. Nice. And I like it.
I like Russian Red, which is by MAC. It's a really bright red. Ooh. And there's another one that's a little darker red, like a winter red. And that was called Diva, but also by MAC.
Diva fits.
And then for nails, I like Malaga Red. Or Big Apple Red. I think they're by OPI. I'm not sure.
I don't get red enough to know the names.
Yeah.
But
well, if I do get red, I usually go with those 2 red nail colors.
I love it. I'm going to have to try it next time.
Yeah, I'm always looking for good nude colors and red colors, because I feel like those are hard.
Okay, now that we're on TikTok still.
Yeah.
Have you seen the trend? You guys, I want to try this. It's a beauty blender that they like paint white on, and then they do French tips.
Yes, they wrap the beauty blender in saran wrap, and then they paint.
Mind blown.
Yeah, and then they just like dip their nails in the beauty blender.
Yeah.
We're going to show a clip right here. If you guys are listening to this podcast, remember, we do this on YouTube, and we're showing the clip here. I think it is such a cool... I'm dying to try it.
I'm going to try it. You guys... Let me know if you want me to make a video on how well I do this, but I'm going to try it.
There is a topical clear fast dry coat that gives this really super shine. So if you guys want to take a break from gel manicures, which I think is a great idea, just for overall nail health and less risk of exposure to UV, it's called Posh, and it's this fast dry top coat. It is ridiculous. Literally, you can paint your nails, and 2 minutes later,
this is true. I've witnessed it in the office, literally painting her nails, and her first patient arrives and they're dry already.
They're dry. I walk in and I can put on gloves. I have to make every minute of my day count.
You guys, before she found that nail polish, you may see some pink streaks on the door handles around the office.
Painted over all them. No, it's true. Lacie would walk in the office and be like, "Why does it smell like nail polish in here?" And I'd be like, painting my nails. And she's looking at me like I'm crazy, because I'm about to start seeing patients. She's like, "How is that going to dry?"
Yeah.
But literally, this stuff works so well. So I'm going to link it below.
Yeah. And for those of you that didn't already know that about her, maybe now my Halloween costume makes more sense.
Yeah, you have to go back and look at our Halloween post on Instagram. Yeah.
Fun times. Well, now that we're just on a nail kick.
Yeah. Let's talk nail health. Because I feel like that's something that we don't hear often. And I get a lot of questions about nail. I do have some story highlights on nails because there's so many different types now. There's the powder and there's the gel. I thought the dip powder, you didn't need UV, but you need it at the end to seal it in.
And honestly, I mean, you guys can correct me if I'm wrong, but the dip and the acrylic is basically the same thing. It's
Similar,
just we're dipping your nail into the acrylic instead of brushing it on.
What I worry about is how clean your hand, all those fingers that are getting dipped over and over and over again into the same powder. So that's the only issue I have with the dip. But the dip also has more of a matte, less shiny finish, but it is supposed to last longer. So I've tried it.
Yeah.
Yeah. I like the shine of the gel better.
Yeah, I like the gel better.
Yeah.
Just shiny nails, just pretty.
Yeah.
Yeah.
So let's talk do's and don'ts.
Nails 101.
Nails 101. But I have to tell you guys, nails are one of the things that just take a lot of patience because the fingernail takes 6 months to grow out on average, and the toenail takes a year. So let's say you traumatize or you damage that nail. You have to nurse it for so long to get it back to life that it just takes a lot of patience. And, with nails, they're not designed to be in and out of water. So if you're doing a lot of things with your hands, the nails can get affected. And once the nail starts to get damaged, you may see the area under the nail start to turn white. That is called onycholysis. And that's when the nail starts to lift off. Once that happens, that puts you at so much risk for getting yeast and bacteria because that nail is no longer protecting you against those environmental organisms and so forth. So really have to take extra care of your nails and not, try to be too rough with them and try to keep them short. So,
a lot of people don't realize that we look at nails too. Especially like when I'll room a patient for their skin check, it's a full body skin check. I say, remove your socks and shoes. And they are just mind blown. Like, why?
Why do you need to look at my feet? Like,
you have skin and nails there.
Yes. I always check when I do skin checks. I always check the feet, check the nails because you can get moles and melanoma in the nail.
Yes.
And a lot of people don't know that that's how Bob Marley died, is from a melanoma in his toenail because he played a lot of soccer and he thought, well, this is just a bruise because it was a dark line in his toenail that he attributed to, just playing soccer and getting blood underneath there. Lo and behold, by the time they discovered and actually biopsied it, that it turned out to be melanoma. The melanoma had spread all over his body. It went to the lungs, the brain. So that's the thing with melanoma.
Scary.
And it killed him. And that's the thing with melanoma is if you catch it early, good chance of success. But if you don't catch it, it really just loves to spread.
Yeah. I had a scare last summer. Remy dropped something on my foot.
Oh.
And it was like partially my toe too. And I had a bruise, but then I didn't notice really anything on my toe nail per se. And then a month later, a couple weeks, almost a month later, I noticed when I took my nail polish off, I had this black, like brownish speckle in my nail. And I was like, I've never had this before.
It's good to pay attention.
Yeah.
Typically a bruise or trauma that you get tends to grow out of the nail.
And it has.
Yeah, that's good. And it tends to start at what we call the proximal nail fold, which is where your cuticle is. And it extends all the way to the end of the nail. So if it's a bruise, typically it's sort of cut off halfway. You can also get what are called splinter hemorrhages. It looks like you have a splinter in your nail, but it's actually just blood, little streaks of blood. Again, they don't extend the entire length of the nail, but you should still get it checked. But those are signs of trauma. And a lot of people don't realize that trauma to the nails, particularly the feet, can cause damage to that nail that can be permanent. And once you permanently damage your nail, that's when you get chronic nail fungus. Mm-hmm. So why is nail fungus so hard to treat?
Oh my gosh.
It takes so long to treat. It's so hard to treat.
The hardest.
Why do you think that is?
Because it's under a rock and hard place that gets wet constantly.
That's a great answer. But more so, it's because the nail is now damaged and can't be without fungus, because once the nail gets lifted up, the fungus gets in and that nail can never kick it out.
Because it's not healthy.
The nail's not healthy, and there's fungus everywhere. As long as you make a good home for it, in your sweaty feet that you wear shoes and socks on, and becomes a sort of damp, dark place, it just flourishes. And that's why it's so hard to get rid of.
Yeah.
But there are prescriptions, but there are also some natural ways that I prefer to try to reduce your chances of getting nail fungus. And that is soaks, dilute white vinegar soaks. So you guys take distilled white vinegar, and you can dilute it, if it's a thick skin area like the feet, you could probably dilute, 1 shot glass to 1 or 2 cups of water. Don't do it straight, guys. Now,
don't do it straight.
Don't get a burn and say, and come after me. This is not medical advice.
This is not a cure.
Not a cure. But you can, soak your nails and even your fingers. Some people get a green discoloration under their fingernail as a result of trauma, and that is Pseudomonas bacteria.
Oh, yeah.
Pseudomonas and fungus respond so well to dilute white vinegar. And a lot of people are surprised. They'll come back like weeks later and be like, oh my God, you cured my fungal bacterial infection of the nail. I didn't have to take any medications. And yeah, you could just, clean them out with a little Q-tip. So, that's a little trick, a natural remedy for the nails.
Yeah. So when you guys come to see your dermatologist, or come to see us, it's always nice to have your nail polish off so we can check. But if not, make sure when you are repainting or repolishing that you really take a good look at your nails before painting back over them.
Yes. And acetone actually helps too, although that's a little more harsh. But acetone dries out the nail, so it makes it less favorable for fungus to live on. Because remember, fungus loves damp, environments.
Yes. Ugh. Let's talk cuticles.
Yeah.
Because I just recently heard, and I know this isn't my first time hearing you say this, but not to cut your cuticles. And, I'm guilty. I do it myself. I don't like to have them do it at the salons, but I do it myself.
Well, it's better to just leave your cuticles alone. Okay.
Okay. But who really does that?
Me,
Let me see.
Every dermatologist in the country, because we see so much nail disease. You need your cuticles. They are there for a reason.
But I only cut the excess.
I know the nail, and
is that the same?
You just kind of putting yourself at risk for getting a bacterial or a fungal infection that you may be fine for a while. And I guess if you're not doing a lot with your hands, it might be okay. But they try to push the cuticles back and cut them, and
that's how it works.
Yeah, I know that's how it works. But it's part of the grooming. But I would say no.
Just let it grow out.
If you are going to do that, I would suggest using Aquaphor every night on your nails and your cuticles, just because it serves as a protectant, and it helps self-repair the nails, and it helps hydrate those.
If you do it yourself.
Well, I think it's just a good thing to get in the practice of doing. I know I have a little thing of Aquaphor on my nightstand, and before I go to bed, because your fingers can get a little sticky.
Yeah.
So overnight though is perfect, because our skin loses the most amount of water overnight. So if you coat them with Aquaphor, which is a heavy occlusive, your cuticles and your nails and everything will be, very well hydrated and repaired by the morning.
So then they'll be more visible.
So if you do get a hangnail, don't yank it off.
Let me see your nails.
You want to cut them. But see, I have my cuticles.
Yeah.
Yeah,
Okay.
I wouldn't let her push them back. Every time I do that, I get this reaction around my nails.
What about hangnails?
Well, hangnails, you got to cut those. You got to cut those.
Don't rip them out.
Don't rip them out.
Oh, I'm doing everything wrong, you guys.
But Aquaphor, is a good little trick. I also use it when I get my gel soaked off. I also apply Aquaphor first to the skin around the nail because Aquaphor serves as a protectant so that when they're putting all that acetone on and just, then wrapping that aluminum around it, you're just soaking your skin in acetone for like 10-15 minutes. At least the Aquaphor protects your nail fold so you don't get those hangnails that you have.
That's what that's from?
Yep. Well, it's from irritation.
I'm a mess, you guys.
Well, you've also had a sick child the past
this is true.
week.
This is true.
So, well, I hope that was helpful and that gave you a few tips and tricks for your nails.
Thanks for tuning in, you guys.
Until next time.